My name is Kylie Gillum, and I did my presentation on bipolar disorder because I'm familiar with the mental illness. So what is bipolar disorder, you may ask? Bipolar disorder is also known as mania or bipolar depression. So it's characterized by its highs and lows. A person will often, they will feel themselves in a depressive episode or a very high mania state where they won't need much sleep, or they'll be frequently talking, they'll be restless. So these states can go on for minutes, days, hours, weeks, months. It really just depends on the person. People with bipolar disorder normally seek help within the depressive episodes because that is when things get worse and they contemplate suicide. So 7 out of 10 people are often misdiagnosed the first time. Men being that they are diagnosed with schizophrenia or depression, and women are most likely diagnosed with depression. So, the symptoms, like I stated earlier, mainly just include mania, which is basically you're in more of a vigilant state, you're talking really fast, you can't focus on anything, you're restless. Whereas depressive episodes are completely the opposite. So you have no energy, you sleep way too much, you lose interest in things that you like, so hang out with your friends, relationships you have going, just really anything. You could be thinking about suicide, you could not be eating, you could lose a lot of weight. It really just depends. And then you have more of the extreme symptoms, which are like psychosis, melancholy, where you feel down constantly. Other anxiety disorders and depressive disorders, and mood cycling, where you can go from happy to sad or angry to happy. It really just depends. Prevalence to society normally ranges where it says 2.6% of the US population suffers from bipolar disorder, which is roughly 5.7 million Americans. Statistically, you do have the same amount of men and women who are affected by bipolar disorder, but that does not mean they are diagnosed the same way. Women are more usually diagnosed correctly with bipolar disorder, on the off chance that they are diagnosed correctly. So bipolar disorder can begin as early as childhood, but the median age of onset is 25, and it can carry on into the 30s, 40s, or 50s. But you do have some rare cases where you can find that children who are young can be diagnosed with bipolar disorder. It is a hereditary trait, so if a parent has it, a child has a 15% chance, and then it doubles if both parents have it. So it is treatable. It's very hard to treat because oftentimes people are misdiagnosed with it. So there still is a very high risk of suicide no matter where you go with this disorder. Like I said, women it's more depression, and men it's schizophrenia. Those are the most common misdiagnoses. Main treatments are therapy and medications, but it's hard because normally you have to do multiple medications to offset the manias and the low points. So you have to find a happy medium with the medications. Now, children, it's very hard to treat bipolar disorder because you can't offer certain medications because their brains are still developing and they can't have certain things to where it will shut down parts of their brain. So it's very hard in children, and they normally develop other disorders due to this. And 9 times out of 10, they are not going to be diagnosed properly. Treatment options for medications are mainly just mood stabilizers or antipsychotics. So you have medications like fluoxetine, carbamazepine, lithium. They mainly stabilize the mood and help with mania. It's really hard to combine these types of medications, which fluoxetine is also paired with olanzapine, which helps offset depression and anxiety plus the disorder, so that helps a lot. But there are always going to be side effects like worsening depression or panic attacks. You have more anxiety. It really just depends on the person for treatment. It's very hard to treat. So no matter where you go with this disorder, you are always going to have problems. But once you do find that solid treatment, it's very easy to become better. No matter where you go, you're always going to have certain issues. This was my take on bipolar disorder. Thank you for listening.